I ended up at GBMC July 6th of last year. I was picked up by a random pedestrian on the side of the street by the convention center in downtown Baltimore. I ended up here because I had endocarditis and a bad blood infection. That lady saved my life.
We have an SBIRT program here at GBMC. The SBIRT program stands for Screening, Brief Intervention, Referral to Treatment. It's a screening built into EPIC that the patients have a series of questions that they answer through a nursing screening, and then they calculate a score based on that screening, and if they screen positive, they are flagged for one of our peer recovery coaches to see.
When we become aware that a patient meets the criteria for one of us to come in and speak to them, we go in with the approach of just learning what their history has been. What's been your background? What do you think what the behaviors that you're practicing affected your life in any kind of way that you might want help in changing?
When we adopted our SBIRT Peer Recovery Coach program, we decided to leverage the EPIC system to really make this work and automate it and make it a reliable system. So through that, we've created the peer recovery screens where our triage nurses will screen patients 18 and over who come in. The physicians and advanced practitioners have the ability to find out what the screening showed and see if somebody screened positive.
We'll set them up with any kind of treatment that they are willing to accept, whether that's inpatient or outpatient, and then we refer them to our outpatient coach, who will then see them in the community and follow up with them and make sure they're going to their meetings, make sure they're following along with the recovery treatment, and give them any kind of resources they may need later down the road.
How have you been since the last time we met?
Fantastic.
So I became aware of the SBIRT program at GBMC through my colleagues in the emergency department, and I was very excited about it, mainly because not only is the resource available for patients who are coming into the emergency department, but for patients that are sick enough to come in the hospital, many of them also have substance abuse issues. And so the SBIRT program follows the patient beyond the emergency department into the hospital.
It's just become an amazing experience. And every day. When I first got here, I didn't deny opioid addiction. I mean, it was clear to everyone that saw me that I was in a bad way. I was homeless, on the street, and I gave up on life. I was put in contact with the peer recovery specialist, and the guy in particular that I dealt with was fantastic and spent more time with me than he probably was supposed to. But that program provided me an avenue for someone that actually understood some of the things that I'm going through, because a doctor understands the clinical part of what was going on with me, and they understand addiction from a clinical standpoint. But when you're talking to someone that has been through it, you have a little different understanding than someone that sees it from an outside perspective.
The smile on your face, the energy that you bring, it's totally different. It's miraculous.
Absolutely.
From the time that I got here, this program has been amazing. The doctors, the nurses have been a great part of our success, because I don't think that we could do this without them. I know that we couldn't. Their willingness to allow us in and the respect that they give us for what we do. It made bridging the gaps and forming the team that we are here great.
We have had multiple great experiences, multiple great stories come out of this. Patients that come back and just thank us for the screening, thank us for the time that we took just to talk to them.
Now, with the SBIRT program in place, some patients who are accepting of forming a relationship with a peer are more likely to accept the rest of our help. And so that's a huge win for everyone involved.
Whether you're talking opioids, you're talking alcohol, you're talking cocaine, we can save people's lives, we can save people's families, and ultimately save the healthcare system trillions of dollars. The costs to the healthcare system for substance abuse, whether it's the medical complications of IV opioid use or the medical complications of long-standing alcohol, is tremendous. And this is an area that I'm so proud that our state has been addressing, and I'm incredibly proud that our hospital has been addressing.
Well, I'm a person in long-term recovery myself, and so it created an opportunity for me to help other individuals. It's almost like service work. but just on a different level where we're directly seeing patients and just being supportive to them, to their process of hopefully getting into recovery.
Now things are fantastic. I just got married. I'm employed as a subcontractor, and I couldn't have a better life. But that all started here a year ago. It's been amazing.